Hello, my name is Kevin Battle, and I'm here to talk about malaria as my choice of disease for the Biology 100 disease presentation. So in summation, malaria major global is a major global health concern, especially in regions in the tropics. Um, and in this presentation, I'll be covering how it's transmitted, who it affects in particular, and how it can be prevented or treated. So, not advancing. Oh, my apologies. There we go. Okay. So malaria is both the medical and common name for the disease. First and foremost, malaria is a parasitic infection caused by plasmodium species, such as mosquitoes. And unlike bacteria, malaria does not have a gram-positive or negative stain classification. Um, these parasites are protozoans, and they specifically invade red blood cells. So they work their way into the bloodstream, they invade red blood cells, and they multiply. All right, there we go. Now it's working. Okay, so the causes is caused by Plasmodium parasites, transmitted by female mosquitoes. The most dangerous of these species being the Plasmodium falciparum, if I'm saying that correctly. If not, I apologize. Which causes the most severe cases of malaria. So once inside the body, these parasites multiply really rapidly within the blood cell, leading to these terrible symptoms as well as the illness overall. Okay, so nutritional needs and optimal environment. This parasite relies on nutrients from the human blood cells, which is why it's a parasite. It needs a host to survive, that host being human blood cells, red blood cells specifically. Um, Being as it lives in the bloodstream. It thrives in warm, humid environments that allow these mosquitoes to breed easily. So wherever the hosts, wherever the transmission insects lives, it needs to be able to meet those specific environmental conditions. So mosquitoes like humid environments, kind of wet environments, rather warm. Wherever you see mosquitoes, that's where that virus is not virus, parasite is going to want to live as well. Standing water, which is essential for mosquito breeding, very common in tropical, subtropical regions. Wherever you see the mosquito breeding, more likely to see standing water, you're more likely to see malaria spread. Mode of transmission, and then most affected population. Malaria, again, is transmitted through the bite of infected mosquitoes. So from infected host to host, wherever the parasite can survive. It can't spread through casual contact. It's not an airborne disease. It's not disease spread through bodily fluids. It's a disease. Well, it's not a disease spread by like respiration. It's not one of those diseases. It's spread specifically from the mosquitoes themselves. Most affected populations are small children, pregnant women, and specifically region-wise, the people of sub-Saharan Africa. That's where we see the majority of these malaria outbreaks. Um, so people traveling to these regions are also at similar risk. And then, of course, you get pregnant women, young children, older people more likely to succumb to these symptoms of malaria. Okay, so signs, symptoms. What we have here, early symptoms, they resemble things such as the flu. So um, in cases like that, sometimes people delay treatment because they don't realize they have malaria until the symptoms crank up and they get more intense. So common symptoms include like fever, chills, headaches, fatigue, nausea, again, like flu-like symptoms, um, as well as muscle pain. And they can reoccur in cycles, basically coming in waves. And these waves align with the parasite's reproduction within the body. So as those parasites reproduce, we have another wave of high fever, nausea, headache, pain, all that. So it starts off something rather simple as these parasites are just starting to reproduce. And then once they are in full on takeover, then the symptoms get very, very intense. And then it's noticeable that it's not something as simple as a flu. And then something more. And then by that time, normally people are seeking further treatment. So body systems affected. Um, Malaria primarily affects the circulatory system, destroying these red blood cells. The liver is also impacted because it's a main area for the parasite's life cycle. Severe cases can also affect parts of the body like the brain, leading to things such as cerebral malaria. And then organ failure can be the result of untreated symptoms or untreated, yes, untreated symptoms. I don't know why I thought I worded that weird. Treatment, testing, and diagnosis. So again, malaria being as though it is attacking these red blood cells. Malaria is diagnosed through blood smears and rapid diagnostic testing. Treatment usually involves some type of anti-malarial medications, and then early diagnosis greatly improves these survival rates. So risk factors. Um, So traveling to areas where you know malaria is prevalent, that's a main risk factor. Um, in these areas, sometimes there's limited access to healthcare, which can increase the mortality of the disease. And according to the CDC, malaria remains as a wide, excuse me, a widespread disease in multiple parts of Africa, despite ongoing prevention efforts. So take proper measures when traveling to areas that you know malaria is endemic. Vaccination and complications. There are two vaccines currently approved: the RTS vaccine and R21 vaccine. These vaccines severely they reduce the severity, but they don't prevent malaria as a whole. Again, untreated malaria can cause things such as anemia, organ failure, death, so on and so forth. Other preventative measures, things such as insecticides, um, bug nets. Bug nets are basically these breathable cloth sheets that you hang around your bed or areas where you're going to be sitting for a long period of time. And those basically make it so that insects such as mosquitoes can't land on your skin and then bite you and then infect you with disease such as malaria. You can also do things such as eliminating areas of visible standing water because, as we know, that's where mosquitoes like to breed and reproduce. Areas with high mosquito traffic, you're more likely to find malaria, especially if you're in regions such as sub-Saharan Africa, where you know malaria is more prevalent. So, just trying to eliminate root causes that can help you with overall prevention of disease. Um, and then there is medication, preventative medication that you should take if you are traveling to certain areas, certain shots you should get. That's why whenever you're taking a trip out of town, you can check the CDC, you can check certain government websites, and they'll tell you, hey, if you're going to this place, you might want to look into getting X, Y, and Z shot because they know it can boost your ability to fight off certain diseases if and when you do contract them because you're going to a spot where they're highly prevalent. All right, so true false questions. These questions will help reinforce key concepts that I gave during the presentation. So, is malaria viral? No, that's incorrect. Malaria is a parasite. Is it spread by mosquitoes? Yes, that is true. Is it preventable with things such as bed nets or other preventative measures? Yes, it is preventable, not entirely, but these are steps you can take to reduce your risk. It only affects adults. Completely false. It affects everyone, and then younger children, people with pre-existing health concerns, pregnant women are more at risk to suffering severe complications with this disease. These are my references. All the information, as you can see, is presented from reputable sources. Once again, thank you for your time.